All right, go ahead.
Medicare and Medicaid, a history. Next. On June 30th, 1965, President Lyndon B. Johnson signs into law Medicare, a federally funded hospital and medical insurance program for elderly Americans age 65 or older, and Medicaid, a state and federally funded program offering coverage to certain low-income people. These were amendments to the Social Security Act of 1935. At the bill signing ceremony, which took place at the Truman Library in Independence, Missouri, former President Harry S. Truman, a member of the Democratic Party, was enrolled as Medicare's first beneficiary and received the first Medicare card. Johnson wanted to recognize Truman, who in 1945 had become the first president to propose national health insurance. Some 19 million people enrolled in Medicare when it went into effect in 1966. Next. In 1972, President Nixon signs the Social Security Amendments of 1972, Public Law 92603, which establishes the Supplemental Security Income (SSI) program of cash assistance for the elderly and individuals with disabilities, and enables states to link SSI and Medicaid eligibility for the elderly and individuals with disabilities. Next. In 1977, Joe Califano, Secretary of the Department of Health, Education, and Welfare, creates the Health Care Financing Administration, HCFA, was created to administer Medicare and work with state governments to administer Medicaid. HCFA, which was renamed the Centers for Medicare and Medicaid Services, CMS, in September 2011, is part of the Department of Health and Human Services and is headquartered in Baltimore. Next. The 80s, when Congress passed the Omnibus Reconciliation Act of 1980, it expanded home health services. The bill also brought Medigap, or Medicare Supplement Insurance, under federal oversight. In 1982, hospice services for the terminally ill were added to a growing list of Medicare benefits. Next. The 1990s. New legislation required state Medicaid programs to cover premiums of the new specified low-income Medicare beneficiary, SLMB, eligibility group. Those eligible for Medicare with incomes between 100 and 120% of the federal poverty level. Other legislation gave those eligible for Medicare coverage more options on the private market through Medicare Part C, Medicare Advantage, originally known as Medicare Plus Choice. The new private options offered attractive add-on benefits such as prescription drug coverage for new enrollees. Next. In December 2003, President George W. Bush signed into law the Medicare Modernization Act, MMA, which added outpatient prescription drug benefits to Medicare. Medicare is partially paid for through payroll taxes taken by the federal government. Next. The Patient Protection and Affordable Care Act of 2010 includes a long list of reform provisions intended to contain Medicare costs while increasing revenue, improving and streamlining its delivery systems, and even increasing services to the program. The ACA changed the tax code starting in 2013. The Medicare payroll tax increased by 0.9% for individuals earning more than $200,000 and for married couples with income above $250,000 and who filed jointly. 2012, Medicare began reducing payments to hospitals with high numbers of preventable hospital readmissions. 2014, the ACA began phasing out payments to disproportionate share hospitals, DSH, which treat significant populations of indigent patients. The payments are scheduled to be eliminated by 2020. 2015, hospitals with a high rate of preventable hospital-acquired conditions are also subject to reduced payments under a provision of ACA. The ACA prevents new physician-owned hospitals from contracting with Medicare and prohibits current physician-owned hospitals that work with Medicare from expanding.
Who's sharing this part?
The next portion is Katie's again. She did 2 portions, Medicare components. Is that the next part?
Yeah.
Okay. Part A, also called Original Medicare, is managed by Medicare and provides Medicare benefits and coverage for inpatient hospital care, inpatient stays in most skilled nursing facilities, hospice, and home health services. Next. Part B, also called Original Medicare, is managed by Medicare and provides Medicare benefits and coverage for doctors and clinical lab services, outpatient and preventative care, screenings, surgical fees and supplies, physical and occupational therapy. Next. Medicare Part C, also called Medicare Advantage, is a different way of getting Medicare Part A and Part B coverage. Medicare Advantage, MA, plans combine Part A, hospital insurance, and Part B, medical insurance, together in one plan. They can also be combined with Part D, prescription drug coverage, creating a Medicare Advantage prescription drug, MAPD, plan. Generally, these plans are offered as health maintenance organizations, which are HMO plans, preferred provider organizations, PPO plans, private fee-for-service, PFFS plans, and special needs plans, SNP plans. Next. A Medicare Part D prescription drug plan, PDP, can be a standalone plan, not joined with other insurance, or it may be combined with a Medicare Advantage plan, also called a Medicare Advantage prescription drug, MAPD plan. That's it.
Who's presenting on the beneficiaries of Medicare?
Their mics are muted.
Oh.
That's me. Sorry, I muted myself. So I'm just going to pull up my screen and read what I have, and you're going to put it together at the end here? Is that what we're doing?
Can you not see the PowerPoint?
I can't hear anything. Sorry.
I can't see the PowerPoint, so they might not be able to either. But I have it pulled up on my computer.
Okay.
Okay. Okay, so if I do... Oops. Sorry.
No problem. So we're right now we're just on the beneficiaries of Medicare slide. So if you just want to, I have the slides up. So just talk through them and tell me when to click through.
Okay. Okay. So... Okay. So sorry, I'm just getting over a cold. So beneficiaries of Medicare. Medicare is a health insurance program designed to assist the nation's elderly to meet hospital, medical, and other health costs. It's for those who are 65 and older, or those who are 65 and or under 65 with certain disabilities, those under age 65 who are receiving disability benefits from Social Security or the Railroad Retirement Board, or those having end-stage renal disease or ALS. Next. How Medicare is funded. It is paid through 2 trust fund accounts held by the U.S. Treasury, and these funds can only be used for Medicare. The first one is the Hospital Insurance Trust Fund, or short for HI. It is funded by payroll taxes by employees, employers, and people who are self-employed. And other sources come from income tax paid on Social Security benefits, interest earned on the trust fund investments, and Medicare Part A premiums from people who aren't eligible for the premium-free Part A. And what does it pay for? It pays for Medicare Part A, which is the hospital insurance, like for inpatient hospital care, skilled nursing facilities, home health care, and hospice care. And it also pays for the Medicare program administration, like costs for paying benefits, collecting Medicare taxes, and combating fraud and abuse. Next. How Medicare is funded. Oh, sorry. So this is the second one. So this is the Supplementary Medical Insurance, SMI Trust Fund. It is funded by the federal government, and it's authorized by the Congress. And the premiums, also from premiums from people enrolled in Medicare Part B and Medicare prescription drug coverage, which is Part D, and other sources, like mentioned before, like interest earned and trust fund investments. And it specifically pays for Part B and Part D benefits, and then also for administration costs and combating fraud and abuse. Next. This is just a graph, kind of give you a visual of the total revenue. This is for 2014. As you can see that the total revenue was $599.3 billion, which is pretty phenomenal. A lot. The next, beneficiaries of Medicaid. Medicaid provides health coverage to nearly 60 million Americans, including children, parents, pregnant women, seniors, and individuals with disabilities. These individuals may qualify for free or low-cost care through Medicaid based on income and family size. Other eligibility criteria are that you have to be a legal resident and have documentation of such. How Medicaid is funded. It is a joint by the federal government and states. The federal government pays the states for a specified percentage of the program, which is called the FMAP, Federal Medical Assistance Percentage. And they do it based upon the state's per capita income. So the regular average state is 57%, but ranges from 50% in higher states and up to 75% in states with lower per capita incomes. The next slide will kind of have a map to visualize that. And these FMAPs are adjusted for each state on a 3-year cycle to account for fluctuations in the economy. And the FMAP is published annually in the Federal Register, so they account for it. The federal government guarantees matching funds to states for qualifying Medicaid expenditures. States are guaranteed at least $1 in federal funds for every $1 in state spending on the program. This is an incentive for the states also. This open-ended financing structure allows federal funds to flow to states based on actual costs and needs as economic circumstances change. Next. Here's the map, and you kind of get an idea of which states receive more federal aid from the government. Next. I think that's it, actually.
All right, Medicare Trust Fund.
Okay, that's me. Okay, on the Medicare Trust Fund, payments for medical services covered under Medicare come from 2 trust funds. The Hospital Insurance Fund covers Medicare Part A payments to hospitals, and the Supplementary Medical Insurance Fund pays the doctor and outpatient medical expenses covered under Parts B and D of Medicare. The trust funds take in the money designated to pay for the Medicare services and make payments to the healthcare providers when claims are submitted. Next. As far as bankruptcy projections go, when they look out several decades, they've found the projections of Medicare costs are highly unreliable because they can't predict how things are going to go. But even with recent changes, projections indicate that it will face a substantial financial shortfall. The estimated date for depletion for Part A Medicare is 2030, but Parts B and D are sufficiently financed for the next 10 years and beyond by the premiums and general income from them. And that's the end of mine.
Okay, I think I'm the next part, and I should be the last part too. Can everybody hear me okay?
Yep.
Okay, so it's a huge partisan issue, and we're kind of in a pickle. Nobody wants their taxes raised, but also there are a lot of people that need help with healthcare, and so that's been a major, I guess, debate in the ongoing presidential race, and people have very strong opinions about it. There's three main issues that it's inadequate for doctors. The inadequate reimbursement, so basically they don't get paid what their full charge was. They're not getting paid the full amount. Also, the timeliness of reimbursement is very slow. Well, I shouldn't say very. I'm not a doctor. I don't know how slow, but and then my major is rec management. I'm going into occupational therapy, and the people I've interviewed have said there is a lot of paperwork involved with CMS in general. So yeah, and just from thinking about it, this could trickle down into quality of care, I guess, willingness of people to accept payment from Medicaid and Medicare. So that could have an effect on the doctors themselves as well. Okay. Okay, I'll read this next slide. Fraud and waste. I'm sorry, I'm not saying next. I'm clicking through them myself. Let's see. Many people receive help and in turn from these tax-funded programs that don't really need it. This adds to the cost of these programs and creates culture in America of dependability on government help to make a living. Additionally, there are many health conditions that can be prevented and even cured simply with lifestyle changes. For example, CMS programs paid $8 billion to cover the cost of illnesses related to obesity in 2013. These people that receive the money from the government for healthcare, some may not be actively pursuing a healthier lifestyle. So I guess it relies on the virtue of the people of America in a way. And I feel like that also can kill it for the people that really need the help. The people that don't really need it, that are using it, that it misuses it so that the people that really need it are less likely to get the help that they need. Also, as I was reading about it, next slide, it is a very complex situation. There's many pieces of legislation that smother the effectiveness of the programs. And of course they have good intentions, but there may need to be a major change in many things, but especially in the budget. I'll read this. I don't know if I can remember those numbers. According to page 62 of the actuarial report of the Boards of Trustees, Federal Hospital Insurance and Federal Supplementary Medical Insurance Trust Funds, in the year 2085, CMS will have a negative ratio of cost to income that will have persisted for 70 years since 2018. So, I mean, within the next decade, 10 to 20 years, it's going to be, I mean, something's going to have to be changed, or the cost is going to become way too much, which hopefully it can continue, but we will see. And I think that's the end of the PowerPoint. There's some works cited on the next page. So
Great. Good job, guys. I'm going to just ask you each question here really quick. So I'll start with Shireen and then just work my way over. So Shireen, and this is the same question for everybody. What was the most surprising thing that you learned as you were doing your studies for about CMS?
Um, with aging parents, I've had to deal with Medicare and all that kind of stuff a lot, just helping them through it. But I guess a lot of it, being self-employed, I see what we, as company owners, pay into that fund, and to know it's not looking good for us to use any of it is a little disheartening.
Gotcha. Katie, same question.
I think that it's amazing that this Medicare and Medicaid started like 80 years ago, and it still seems to be happening. It's still going strong. I remember when I was a child, they told me, "Don't count on it being there when you retire. It'll be gone." And I could be retiring in the next 20 years, and it looks like it could still be viable. So I'm pretty proud of our country that we came up with this.
Thank you. Lincoln, same question.
That's a great question. So I'm actually really interested in politics, and I've been following the presidential race very, very closely. I can see both sides of the spectrum, where if we're going to keep it the same way, taxes will have to be raised in order to pay for it. But also, if we were to eliminate it, then millions and billions of people would go without health care. So it's a pickle. There's something that has to be changed, but also, as I've thought about it, I don't know what you could change without completely restoring a different kind of program. And that's why it's such a hot topic, is because of the pickle, and I've just realized exactly how much money is involved with this, and where that money comes from. It's just made me more aware of the major problem that it is, and so a solution is going to take some really smart people to figure it out. So,
Megan, same question.
I think overall, just the amount of money that goes into, particularly the Medicare program, is really interesting to me. That it is just so much money, and it was interesting to learn that the states will match per dollar how much, or the government, I'm sorry, will match, and obviously we have poorer states than others. And so it's almost like it just goes into a big pot and they just kind of divvy it up. Like the others, I don't know if it's the best system, but yeah, I don't know. It'll be interesting to see. Like Katie, I hear it's not going to be there when we retire. So I guess it's just a waiting game to see how it all plans out, and especially with our politics.
Great. Well, I'm going to stop the broadcast now, but I do have a question for you guys offline, so I'm going to go ahead and stop it.